Good day, everybody. Welcome to Dr. Tom's Tips on Tuesdays at 10 in 10. My name is Rolando, and we're here with Dr. Tom Hirsch and two special guests, Danny and Rita. The focus of Dr. Tom's Tips today is how Isolite empowers the dental team. So a couple tips around that. Good morning, good day, everybody. How are you guys doing on a election day? Check it out. I
Yes,
voted.
we voted too.
Hey, Rolando, good morning, everybody. Everybody get out there and vote today. Really, really important. But today's tips are not about me and dentistry, but it's about my team and how Isolite empowers my team and my dental assistants in particular, both Danny right here and Rita in the red. Rita in red are my two superstar dental assistants, and they're my right hands and my left hands, and I couldn't work without them. And so I'm going to just let them speak today on how Isolite has empowered them. And Rolando, you can ask them some questions and kind of go through this whole thing today.
So first of all, thank you for joining. I really appreciate it. I know you all are busy. So when you look at it, there are a whole bunch of new folks who decided to add Isolite to their practices. And what I'd like you to do is kind of share with us what it is about the system that's empowered you to kind of give other people some tips. So I'll start. Danny, if I were to ask you, what's one thing that the system has done for you, what would one thing be?
Well, it makes my job much easier and
Wow.
faster.
When you say easier, what do you mean by easier?
Well, it allows Dr. Hirsch to do his job while I'm getting things ready, and I can go into another room and take an x-ray or anything I need to get materials ready.
Has it decreased kind of the stress between the two of you during the course of your procedures and all?
Yeah, I think so. I think it helps run much smoother.
That's so cool. So let me ask you this, Rita. If I were to ask you to never use the Isolite again, how would you feel?
I would quit. I'm not working without Isolite. I love
Wait.
Isolite. I cannot imagine working without Isolite anymore.
Yeah.
It makes the life faster, easier, we're more efficient. It's easy on the patient, and we used it on me, and it was amazing. I can't imagine. I can't imagine being there next to Dr. Hirsch and aspirating with HVE and being so close to him. And no, it's just simply easier, faster, more efficient.
And when it was used in you, what was that experience like?
I love that. I didn't have to have my jaw open, try to stay open all the time because it has a bite block in there. I simply rest my jaw on it, and I was literally sleeping when they were working on me.
Yeah. Here's the thing. Rita's a gagger, by the way.
Yes, I am.
We have a hard time. We have a hard time taking X-rays on Rita, and she's a gagger. And I don't think she has 20 millimeters of opening. Open as wide as you can. I mean, well, that's pretty good right there. but seriously, doing full mouth reconstruction on her was really tough and really impossible. And her jaw would have been. Oh, and she didn't want any IV sedation either. I only wanted to do her with IV sedation. She didn't want any IV sedation. She probably didn't trust me. She probably didn't know. Got 2 minutes in the room. She probably didn't want to know what was going to happen when she went out.
I'm the worst patient, but with Isolite, I did pretty good.
She did great.
Yeah, and from your perspective, Rita, when it was in there, what surprised you the most?
What surprised me the most? It surprised me how easy it is to put it in patient mouth, and how easy it is for the patient, and how much easier it is for Dr. Hirsch to work, especially on difficult patients like me. I work here, but I'm a difficult patient, and I know it.
Amen. She's a difficult patient.
Yes.
I mean, totally.
Yeah, I know it. I know it.
So back to Danny. So one of the things he said, it's freedom. It frees you up to get around. It helps you that. If I were to ask you, what's another thing that it's done to help basically empower you as a dental assistant?
Well, just that freedom. And I think by having that freedom to get my materials ready makes me a better assistant, a better and more efficient assistant.
And here's one of the things that she really does super, super well. We have Sherrick in the office. We have CAD/CAM dentistry in the office. And sometimes we go crazy and we're really, really busy and I can't be in there to scan, Or let's say we just want to scan from study. You know what we've done in the practice? We have virtually eliminated all of our physical impressions. Rarely do we take a physical impression anymore with alginate or any PVS material. It's all digital right now. And it's great because these two women are so great at taking digital x-rays. So tell them your experience with that. I leave the room, I'm gone, or I've never come in the room
digital
and they're there.
Scanning, not x-rays.
Digital
Scanning. No, digital scanning. I'm sorry.
It's okay. We're here to correct him.
Yeah, all the time.
That's why we're here.
So, from a team perspective, if you were to give other practices tips on the Isolite that they have, Rita or Danny, what would you tell them about that system that would really that you've learned about it?
I would tell every assistant, start using the Isolite, and after a week or two, you will see how much easier your job is going to be, how much more efficient you're going to be, how much more work you can do at the same time. When doctor is working, you can do other things.
And thank you for that, Rita. That's awesome. And Danny, from your experience using it, what would you tell other dental assistants also?
That they should get it, that their doctor should just go out and get it. I mean, it makes everything so much easier. You can keep patients' mouth open. Their jaw doesn't get tired. I can scan much more easily. I mean, I would tell them that it's the best thing since sliced bread, I guess.
So if people have it, so what I'm hearing is this: if people have it, give it a chance. Was it something that was really easy to pick up, or did you have to change things that you were doing?
Well, there was definitely some training as far as sizing and how to place the mouthpiece, maintenance, but it's not that difficult.
Yeah, it's
very simple.
All assistants will get it really fast. All I would say to the assistant, just use it.
Yes.
I would say, just use it.
Yeah.
And kind of push through to get it in, and it'll become easier. Is that what I understand?
Just getting used to it, and then you're gonna love it.
And some patients don't love it, but they will tolerate it. Say, this is what we're going to do. This is our protocol, especially now. This is protocol to keep the airborne aerosol down, especially now.
Awesome. Well, hey, first of all, it is election day, and really appreciate you guys joining here and spending a couple of minutes here to kind of share with us the experience you have. Cracks me up, Rita, when you said, I quit.
I would.
I thought that's so funny. And Danny, you've been on before, so really appreciate you coming on here. Dr. Hirsch, first of all, thank you for taking a couple of minutes here. Any final word before we close out with regard to tips working with things you've learned that will help other practices introduce the system to their dental team?
I've got one final tip for you. You know what? Some people are worried about choosing the wrong size mouthpiece. Okay, you picked up a medium DV mouthpiece, and the doggone thing's too big. You know what? Pick up a pair of scissors and trim it down to the right size. You picked up a mouthpiece, you tried it in, and it's too small. Okay, you know what? I just made a $2.75 mistake. For God's sakes, put it off to the side. Get another one out that's the appropriate size. Don't worry about the pennies when you've got the dollars coming in. So that doesn't happen too often that you pick the wrong side, but if you do, get another mouthpiece. Don't fight City Hall here. It's less than it's less than a drop of bonding agent. Seriously, is the cost of that whole thing.
Well, cool.
It's less than the cup of your Starbucks coffee. So just make life easy on yourself.
Awesome. Hey, folks, thank you so much. Really appreciate it. Those of you who are watching this, if you have questions for us or if there are other things that you'd like to learn, please let us know. More happy to do that. If you like the content of this, please share. If you have any comments that you'd like to make with Rita or for Rita or with Danny, please let him know. Always, it's always a pleasure to see Dr. Hirsch. It's always fun every time we get on. It's always crazy. I love it. And please be safe. Hope you guys are well, and we'll see you next Tuesday.
One final thing. I want everybody to go out and Google Dr. Armadingo.
All right. We're good.
That's your final thing of the day. Dr. Armadingo. Armadingo. Google it.
Right on. All right. Hey, thank you guys.
I bet you just hate when I do that, don't you, Rolando?
No, I love it. I love it. We'll talk to you all later. Have a great
Bye, everybody.
day.